Hello folks, Gary Perkins, HCPC, Paramedic and Medical Director at Sussex First Aid Courses here. This is the first time I'm doing a live broadcast, to be honest with you, and I'm doing it on a Saturday morning because we've had a number of phone calls from clients, a lot of our dental clients, patients, and last week by teaching GPs, they also were asking advice on what do we do with the latest announcement of shortages regarding auto-injectors, especially EpiPens, etc. So I just very quickly going to put this kind of demonstration together and talk about the practical ground level use of EpiPens and what if your loved one, your daughter, your son, their EpiPen is running out of date. What should we do? Because there are some real concerns out there and we're not too sure when we're going to be back up to date with the influx of the new up-to-date pens. So here we go. So I have an EpiPen here, just demonstration. And this is probably the type you've got there in your home, comes in a box and etc. And if you just have a quick look, take your EpiPen out of the protective casing, and do be careful there folks, do not take the blue cap off the end unless you're actually going to use it. So just looking at the side there is where you see the expiry date. So this is quite important, and often in our teachings people have said, well, what do we do if it's run out of date and we actually need to use it because somebody has gone into anaphylaxis? Well, the advice has always been at ground level, look, if somebody truly is in anaphylaxis, it's life-threatening, so use the pen even though it is out of date. So what we're saying here is ideally, yes, your EpiPen should be in date. You should check them, and the latest advice that's been released today is that there's been extension on EpiPens, and currently they're talking about a 0.3 milligram. So the 0.3 milligram would be used from 6 years of age upwards, including adults, etc. So they're saying you can use it up to 4 months out of expiry date. So check it there. Do seek advice from your GP, etc. Regards extension on top of that if we get to that stage. Hopefully we won't, because they're trying to resolve this problem soon. The reality is, if you do have a loved one in anaphylaxis, the only pen you have is out of date further than 4 months, and 4 months is the guidelines at the moment, well, personally, you probably may need to use it. Because if that's all you have, if it's truly life-threatening, use the adrenaline. It may well lose its strength, etc. But something's better than nothing, in my eyes, at ground level. So a couple of things they're saying to look out for. With the EpiPen here, if you just have a look, there's a little window here. I'll just hold it that way around. I'm not sure if you can see that. But ideally, you should be able to see clear fluid. So if it's brown, murky, any particles in there, then they're saying do not use it. Ideally, you'll have 2 EpiPens with you, so check to see if you can use the other one instead. There is the 0.15 milligrams as well. That isn't affected. It's shortages, but there's no advice on that at the moment. So that's normally 6 years of age and below. Well, again, if you're going to need to use this pen in a medical emergency and there's no alternative medication available, then that would be down to you as the provider. What are you going to do there? Are you going to hold back and wait, or are you going to use it? They're holding back on that advice at the moment. I don't know why they're saying, yes, we're giving a 4-month extension on the 0.3 milligram and not on the lower dose, so 0.15 milligrams, sorry. So that would be down to that time and a moment, and basically a calculated risk should you use it. Well, in a medical emergency, just recently in the news, there's been a number of cases where auto-injector, an EpiPen, MRA pen has not been administered in a medical emergency. Many people have a fear about, should I use it, should I not? I don't want to make a mistake. Look, at the end of the day, somebody with an onset, flushed face, wheezing, tightness of the chest, breathing problems, maybe they've got a rash coming up, hives and they're itching, etc. Often they're overwhelmed with a feeling of impending doom, etc. Lightheadedness, falling blood pressure. If that's the case, it's true anaphylaxis. Lay them down before they fall down. Raise the legs. A medical provider provide oxygen therapy at 15 litres immediately, and then of course find your auto injector or your adrenaline 1 in 1,000, which should be administered ideally IM middle of the fire there. And also, just as a footnote, with these auto injectors, this is the EpiPen that traditionally has always been administered over a 10-second period. They are saying with the new guidelines you actually have to administer, hold very firmly in the fire for at least 3 seconds. Now in our guidelines for teaching wise, I always mention 5 seconds. 5 seconds to be safe, because many people do administer these auto injectors are way too quick and then take it out, and you've got that risk where you haven't administered medicine. Now just on a quick footnote, EpiPen, which is a marvellous pen, I have to say. You just take one cap off. There it is, easy to use. Apply firmly again into the middle of the fire. Hold for 5 seconds. They too also have shortages. There's been no advice released there at the moment of what to do. But again, if you only have an EpiPen and it's out of date by a few months or so, and someone's in anaphylaxis, well, you're going to use it, and naturally you're going to call 999. So just to recap, EpiPen there if you have one, excellent easy to use pen. You only have one lid to take off. It's obvious that's the end, into the fire, hold for 5 full seconds. Now with the EpiPen you need to be a bit careful here, because EpiPen won't like this, but the reality is at ground level often these are administered inappropriately. You must remember with your EpiPen it has a blue top, blue to the sky. Take the top off, it's ready to use. Orange to the fire, and then when you administer into the middle of the fire, hold for 5 long seconds. Now take a look at the time, watch the clock, and 5 minutes on, if the patient's still deteriorating, no improvement, a second dose should be administered if you have it. So a second, third, fourth dose if need be, every 5 minutes on the deterioration of the patient. Lay him down, legs raised, 999. And if doubt, at ground level, use your adrenaline 1 in 1,000, EpiPen, auto-injector, EpiPen, etc., because it can be a lifesaver. Any further information, and that's a brief kind of ground level up to date I've given there, and there's probably a lot more involved. At ground level, the reality is if you have doubt, use your EpiPen, because it literally can save that person's life. Please do contact us for any more information or help or advice we can give you. We'd love to hear from you. That's Gary Perkins, HCP paramedic. Thank you for watching. Take care. Bye.